I now ask our third speaker, Mr. Mohammed Dahdouh. He is the Director of Physiotherapist at National Diagnostic and Evaluation Center, Ministry of Community Development in Dubai. Please welcome Mr. Mohammed.
I know we have short time, so I will squeeze my presentation in 10 minutes. I have been told. So today I will talk about ICF, which is the International Classification of Functional Disability and Health, and how we are using it in Ministry of Community Development as a framework for disability determination. So today's objectives of the overview of this lecture is what is ICF, what is the aim of it, and why it's important and why we are using it. Second item is how the ICF is used as a model of human functioning and disability, and how can I use ICF ideas in practical or practice as a service, and why should we use the ICF as a framework already in our rehabilitation services. So, I'm working in National Diagnosis and Assessment Center, which the services that we are provide is assessment of people of termination card, disability card for everyone inside UAE, however he is a citizen or expat. Development, we are doing also developmental assessment, which is an early screening for disability or developmental delay, and also we are doing assessment of eligibility for service for early intervention and inclusion into the mainstream schools. Also, we are doing a comprehensive assessment of abilities and skills about activities and participation for people of determination using the ICF model as a framework for disability determination. So, what is ICF? ICF actually has been developed and adopted by WHO, the World Health Organization, in 2001, which is providing a very useful framework for structuring intervention service for children and adults with disabilities. Actually, it was before using another model, but now by 2001 they make a biopsychological model which fuses together elements of both the medical and social model of disability. So the classification system is not a measurement tool. It's not classified people like most classification system, but it describes limitation and strengths in both individual and population levels. So the aim of ICF, and this is very important for all the people who are working in the medical service for people with termination, as it provides scientific basis for consequence of health condition. The main use of the ICF in our work is to provide a systematic coding scheme for health information system and to establish a common language to improve the communication. The ICF model of human functional disability, when they start to produce it or announce it for everyone by WHO, it was like having a lot of attention of people because it's reflecting the change from disease to health. And you will see the model now. Okay? So the terminologies that we are using in the ICF is body functional, which is the physiological function of body system, including psychological function. Second one is body structure, which is the anatomical part of the body, such as organs, limbs, and their components. And the impairments are involved in body functional structure. Activity is how we are doing the task, how the individual is doing the task. Participation is the involvement in life situation, and there is activity limitation and participation restrictions. And also the main important terminology we are using is the environmental factors, which make up the physical and social and attitudinal environment in which people live and conduct their lives. We are trying to make the life easy for everyone. So the ICF biopsychological model is, it has two parts, okay? Each part has two components. Part one is functional and disability, which is body function and body structure, and activities and participation. And the second part is contextual factors, which is environmental factors and personal factor. So, activities is describe individual function as whole person, and it's range from basic to complex. Basic would be, for example, dressing, eating, and bathing. Complex include work or schooling or civic activities. So the activities is what people already can do without assistance or barriers. Okay. Participation is the functioning considering the impact of barriers and facilitation of the environment. So activities and participation, let's have some example. For someone who is considered people of termination, he need to participate in learning and applying knowledge, in communication, mobility or ambulation, domestic life and major life areas, and community and social and civic life. So how we are using the ICF as a framework? When we are using it, actually it leads to specific preparation for specific functional task. We are focusing more on functional directed goal and the interaction between the person and the task and the environment. So, ICF and children with disabilities or children of people of termination, when working with the children with disabilities and their families, the main challenge actually with parents or families is to relate how the therapeutic activities that we are doing in the clinic or in the rehabilitation center are connected to the desired outcome. Traditionally, it was impaired pace, so they are focusing on addressing the problem just only of body function and structure. But now the ICF model is provide an opportunity to the family to talk, and even the children or the adults to talk with us to put the primary goal for self-choosing goal that it's reflecting or addressing the function and participation in the community. So the ICF model gives permission to address people's self-determined goals very broadly, and it allows families to put the ideal goal for their son or their individuals, which will help them to achieve their goals fast. So, I'm talking now about our department, the Assessment and Diagnostic Center in the Ministry of Community Development, and how it will help people for service provision. At the social level, we are actually doing the assessment using the ICF to know or to determine or to platform for people how we can help them for environmental assessment. But everyone knows by 2016, UAE adopted the term people of determination instead of disability, in recognition of achievement in different fields. With the change came a lot of laws guarantee equality, accessibility, and non-discrimination that included social developmental policy. From this point, we are actually giving, according with the data we are collecting from people of termination, that they came for assessments with people of termination card, we are collecting data, we are doing like a platform to see what is exactly the environmental barriers, what is the personal barriers they are facing every day, and from this point we give suggestion and we are trying to help to improve the activity around the social integration inside the community. So, any questions? I just want to say one word. I'm doing assessment every day for 5 to 7 people of termination, for people of termination card. And the main concern, guys, well, what they are looking for, not empathy. They are looking for opportunities. So hopefully everyone can, if he has something to give and help, I would like to share with him some ideas. This is my email, and thank you.
our speaker, Mr. Muhammad. Thank you very much.